Hi all, my name is Josephine Connolly Sconin, and I am the task force chair for the New York State Academy of Nutrition and Dietetics Therapeutic Diet Order Writing Privileges Committee. And today I'm going to briefly go through a presentation that will give you all the background information you need on therapeutic diet order writing privileges so that you are prepared to meet with your legislator. So first, please be clear that the objective of this legislation is to protect the public through delivery of the most appropriate diet and nutrition therapy while in a hospital or a long-term care facility. Secondly, our objective is to increase efficiency of operations related to food and nutrition in hospitals and long-term care facilities. CMS estimates that having RDs write diet orders would save $459 million a year nationally. CMS is the Centers for Medicare and Medicaid Services. So we will achieve these objectives through passing of bills, a Senate bill and Assembly bill, that amend our New York State Department of Education law that establishes certification for nutrition and dietitians. That education law is Article 157. And the two bills that we have to amend this law is Senate Bill 3330 and Assembly Bill 6398. And these are considered same as bills, meaning it's the exact same language in both bills. So when they both pass, no reconciliation would be necessary. The Senate bill has already passed. So at this time, we are focusing on contacting our Assembly members. Please keep in mind that since this bill amends our certification law, it covers not only RDs, but certified dietitians and nutritionists. And in fact, if you are an RD in New York State, you do need to become a certified dietitian nutritionist in order to avail yourself of that benefit. That would occur with the passage of these bills. So next you see the actual education law, Article 157. This is just a little snippet of it, but if you go to NewYorkStateEd.gov, Office of the Professions, you can easily find this and read through our current certification law. So what's in the amendment? So the language is a simple sentence. Notwithstanding any other provision of law to the contrary, a certified dietitian or certified nutritionist may prescribe, order, write, review, evaluate, monitor, and manage therapeutic diets, including enteral and parental nutrition, in hospitals, as well as long-term care facilities and a number of other associated types of facilities, when competency is determined by the medical director or governing body of such a facility. So let me first jump to permissive and inclusive. So you'll see the end of that sentence is when competency is determined. So this bill, when passed as law and amends our certification law, would simply allow hospitals and long-term care facilities to privilege certified dietitians and nutritionists in hospitals and long-term care facilities to write diet orders. In long-term care facilities, the language is a little bit different. They need to be privileged by each attending for a particular resident. So it's a bit of a tweak on the language there. But most importantly is it's permissive. It allows facilities to do this. It does not mandate that they do that. And it's really important for our legislative officials to understand that. So again, once this were to pass, it doesn't mean that certified dietitians, nutritionists in New York State could automatically start writing diet orders. It would be up to the clinical nutrition managers in each facility to approach their house staff office or the governing body to work through a process where RDs, certified dietitians, nutritionists, would be deemed competent. And hospitals might decide that they want to allow their RDs, certified dietitians, nutritionists, to write PO diet orders for all of them. Maybe for some of them, they're deemed competent to write tube feeding orders, and maybe just a select few are determined competent to write the TPN orders. So it really is up to the facility and the director of each nutrition department to work through that process. But this law, or this bill, when it becomes law, would simply allow that process. So it's really, really important that legislators understand that. It's not mandating any of this. It also is inclusive in that it allows RDs, certified dietitians, nutritionists, to be one of many different healthcare providers that can write diet orders, including attending physicians, resident physicians, NPs and PAs in most facilities. So we're not asking to take that privilege away from anybody else. We're just asking to be identified as an additional healthcare team member who can do so. The language, that sentence that I read earlier on, the amendment, is there are two words that sometimes come up. You don't need to necessarily bring it up, but if asked, you should be able to explain. So the word order has to be in there because that term is necessary for RNs to be able to administer our diet orders, especially to hang a TPN bag or to hang a tube feeding bag. So that term is necessary in order for this to work. And the term prescribe is necessary for pharmacists to dispense TPN. And if I get into this conversation, if I'm asked, I'll simply say that TPN is a form of nutrients. We're not asking to be able to write or prescribe anything else except macronutrients and micronutrients that would be in a TPN bag. And the reason why it has to come from pharmacy is because TPN has to come from a sterile environment. And we know that kitchens are not sterile environments. So that's why the term prescribe is in that sentence, in that amendment to our certification law. Why is this important? We all know why it's important. It improves patient safety and clinical care. We can all speak to the stories about how inefficient the processes are now. Most of us have workarounds where we go into the diet order, we write the diet order, but it needs to be signed off by an LIP. And the process of doing that is quite inefficient, not only for us, but highly inefficient for the LIPs that need to sign off on them as well. So here's a great opportunity to share some stories, especially how difficult it was during COVID and maybe now again during this new phase of COVID, that it is really hard and inefficient to get the LIPs to sign off on our diet orders when we're the ones that teach them how to write it, right? So we not only know the clinical situation of the patient, we also know in detail the diet orders. We know in detail what tube feeding products are available, which ones might be on back order, and the ins and outs and details of the different tube feeding products. We know if there are IV multivitamin shortages or any other supplement shortages and how to work around those. We have a very unique set of knowledge that is critical in order to provide patients with the best nutrition therapy in the most efficient fashion. And you just need to tell some of those stories about your own experience. Why now? Well, it's already quite late because in 2014, the Centers for Medicare and Medicaid indicated that RDs, or qualified nutritionists, that, as the term they use, are the professionals best qualified to provide medical nutrition therapy, including writing diet orders and permitting hospitals or long-term care facilities to extend therapeutic diet order writing privileges is the most efficient way for these facilities to operate. The vast majority of states in the United States, the RDs are already doing this. It is simply because in New York State that we are not licensed. We're one of a few states that don't have licensure, that RDs are not able to avail themselves, and hospitals are not able to avail themselves, as well as long-term care facilities, to take advantage of this opportunity that CMS created with this ruling, because again, we're not licensed. But the states surrounding us, the RDs are already doing that, including New Jersey and Connecticut. So New York State is way behind in providing this level of care to our patients. The COVID pandemic highlighted the need for TDO for patient safety and hospital operational efficiencies. Again, many of us that were working at that time can tell many stories about how we had to develop all these kinds of workarounds to deal with the crazy time that is COVID. I like to remind elected officials that every vented patient needed to be tube fed. And currently there are still vented COVID positive patients that need to be tube fed. And the at least during the first wave of the pandemic, many MDs that were reassigned to hospital units, intensive care units, did not have the experience writing diet orders that dietitians do. So again, sharing some examples of how RDs are the most prepared healthcare providers to write diet orders, and some of your experiences would be quite helpful and meaningful. Next is a simple snippet from the Federal Register in May 2014. It was under the Medicare and Medicaid program regulatory provisions to promote program efficiency, transparency, and burden reduction. So CMS was saying, in order to improve efficiency and reduce the burden of running these healthcare facilities, they identified clearly that RDs are the most qualified people to write diet orders. You can read this highlighted area. It's just a small part of the longer document. This is the long-term care regulations, and the language that's appropriate for long-term care is a resident attending physician may delegate the task of writing diet orders consistent with 483.60 to a qualified dietitian or the clinically qualified nutrition professional who is acting within the scope of practice as defined by state law and is under the supervision of the physician. So that's the language for long-term care facilities. So what can you do? So first, you need to make sure that you are certified. So you might be an RD in New York State and haven't gone through the Department of Ed certification process. So you really should do that. You can also contact your own New York State senator or assembly member requesting they co-sponsor these bills. This is exactly what I'm asking you to do through this presentation today. First, you need to determine if your legislator has already sponsored the bill. So in the New York State Assembly, the website is listed there first, and the Senate has a similar website. You simply put in the bill number, which was in the prior slide, and it'll list the sponsor and the co-sponsors, and you could determine if your legislative official has already sponsored it. If they did, you can email and thank them. If they haven't, then you need to act. Okay. Actually, the websites I just gave you are how to find out who your elected official is, the assembly person or the senator. I'll get to the other website in a moment. So this is how you find out who your elected official is. I'll show you how to determine if they've already sponsored in the next slide. Then you're going to call or email asking for co-sponsorship. There's another document that walks you through that process, which will be shared on the NYSAND website and to many of you through your local associations. Then not only do we want you to call or email, but visit your legislator. In the times of COVID, this will most likely be on Zoom or virtually, but it's critical that you do that and use the summary document, which is also available on the NYSAND website to help walk you through your visit. And then you also need to follow up and see if they actually do co-sponsor after your visit. And if not, continue to contact them to further discuss. The sponsors of our bill are as follows. In the Assembly, it's Fred Veal. In the Senate, it's Gustavo Rivera. You can always email and thank them as well. And we want you to network with your colleagues to advocate for them to also contact their elected assemblyman person, especially at this time. As I said, it's already passed in the Senate at this time. And then also ask your MDs and RNs to contact the sponsors as well, because we need to build support among other licensed professionals. The next slide shows the website that you go to find out who is sponsoring the bill. So you put in the bill number. You have to put a little 0 there, 8A063898. And then it lists the sponsor as Theo. And I did this very early on. I think there are a few co-sponsors now, but not many in the Assembly. And then this is the Senate website that you go to in order to see who in the Senate is co-sponsoring. And you can see in the Senate, it kind of got cut off, but we have a number of co-sponsors in the Senate. And lastly, this is the summary document I referred to that you can use to literally walk through your visit. After reviewing this presentation, you can read it. It's fine. They're simply people. They know you're going to be nervous. And you could say, I'm going to go through this document with you as a way to share my concerns and what I'm asking in terms of your support. And then like the slides that you just listened to, you're going to walk through the goal, the fact that they're same as bills. You can also state that it's passed unanimously in the Senate. I usually do read the one sentence that the amendment consists of, talk about why now and the support we have from Centers for Medicare and Medicaid, explain that it's permissive and inclusive as we discussed. And that's it. Some other tools can be found at the NYSAND or LIAN websites. And I implore you to reach out to your elected official. This is the time, because we're getting, we have the Senate support, we have the Senate approval. If we can just get the Assembly, they are same as bills at this time, and nothing is going to make the Assembly move except their constituents. So as a constituent and an RD, you have an obligation, a professional obligation, to reach out to your elected official, have a conversation with them. You're all skilled communicators. You do this all the time. Explain what you do, discuss with physicians diet orders. You're just going to explain to your elected official how you do that every single day. So good luck on your visit. Just have a little fun with it. If the first one doesn't go well, that's okay. Just start. And then you could also always follow up. So have fun with it. Good luck. And I really do hope that you make that visit. Thank you. Bye-bye.